Hi everyone, I'm Jackie from Active Health Clinic, and today I'm here to talk about hypermobility spectrum disorder and Ehlers Danlos syndrome. So what I've seen in my experience over the years is there's a lot of confusion between these two particular disorders. So what we really need to understand is, well, what's the difference between having a hypermobility spectrum disorder versus when does it broach into hypermobile Ehlers Danlos syndrome or HEDS? So what we really need to understand is that, like a lot of invisible illnesses, there is a huge spectrum, and that spectrum involves, the severity of symptoms. So unfortunately, so it is now 14 types of Ehlers Danlos syndrome. Hypermobile EDS is the only one that does not yet have a genetic variant that we can test for. So that's why this is a difficult one to diagnose. However, on the EDS Society website, there is now a diagnostic criteria for hypermobile Ehlers Danlos syndrome. So this is a really important checklist for maybe not only yourselves, but whether it's a GP, rheumatologist who might not be, as aware of what HEDS is, etc., etc. So any medical professional or yourselves that's wanting to really know, well, what is the diagnostic criteria for this HEDS, then this is available on the website. And we do want to be having this. This was updated in 2017 when all of the criteria and the types were updated as well. And number 14 is coming into play soon. So what I want to talk about is, I guess, just this spectrum of, well, when does HSD become HEDS? And as I mentioned, it is very much a spectrum. So, we may have symptoms down here, but this can progress along the years. As we become deconditioned, our hypermobility might become a little bit more, it'll become more visible. That's what I'm trying to think of the word, or a little bit more limiting. So what we've got to look at in terms of, well, when does it become hypermobile EDS? And that is when we're looking at the severity of the musculoskeletal complications, the skin complications, and other structural tissue fragility. So that's quite a big thing to say. So we've really got to look at this spectrum, and there's lots of information on the EDS Society website, and this really helps break down how to tell the difference between the two. So where there is a very defined line is when we move into the rarer types of Ehlers Danlos syndrome. So classical vascular, etc. So these ones all have a genetic variant that we can test for, firstly, but they have very visible signs, symptoms, and features, okay? So importantly, what I wanted to really talk about today is that this is a spectrum. There is no real defined line between when we have this versus this, apart from the entire spectrum of joint hypermobility, skin fragility, and other tissues. And this can be gut, for example. This is when we look at chronic fatigue syndrome, POTS, joint subluxations, dislocations, and the like. So that's where we're moving more into this hypermobile type. And for a hypermobile EDS, we also need to have some sort of family history of that as well. So we do see probably more of this hypermobility spectrum disorder. It does not mean that you are lesser in terms of being unwell, limited, disabled, whatever you want to talk about. This is, a much of a muchness, and we treat it exactly the same. So we treat everybody as an individual. What are your limitations? What are the problems? How is it impacting your quality of life? Whether we call it HSD or HEDS, let's try not to get caught up in what it's called, but rather let's treat you in terms of your symptoms and your limitations. So I hope this has helped, and if you feel that somebody needs to hear more about this and the definitions, how do we tell the difference, then please share this with them or tag them, and even head on over to our YouTube channel, which I will be doing more and more videos on in terms of all of the Ehlers Danlos syndromes. Thanks everyone.